Okay, hi, my name is Tyler Rondeau. I'm doing the paper slash video prompt number 2 in Management 303, Section 002, Organizational Behavior at Bridgewater State University. And in this prompt, we are the CEO of a large hospital company. COVID's initial crisis response needs have subsided, and we need to explain how I would help reduce stress in the workplace. And we use our understanding of emotional intelligence and how that may play a role with managing the stress in the hospital. So let's jump right into it. So the 4 components of emotional intelligence are self-awareness, self-management, social awareness, and relationship management. And all those come into effect when we're talking about the COVID-19 crisis, especially working at a hospital. For nurses, it's going to be a really high stress job, considering they could be exposed to this disease at any point during their time at the hospital, treating patients and whatnot. So with self-awareness, you just have to be aware of what's around you. So obviously we have sick people that are in the hospital. We have to make sure that we get these people the medicine or whatever they need to be comfortable in the setting. So with these nurses, they have to be aware of, okay, was this person exposed to COVID-19? Do they have something else wrong with them? Or is there something more overwhelming just based on the fact that it's not COVID-19? It could be something else like cancer, or it could be something like cardiovascular disease and stuff like that. So just being self-aware. Self-management's another good one, especially in the high stress scenario. The biggest thing is sleep. You want to make sure you just get to bed early. You want to make sure you're able to just be organized and be able to go do whatever you need to do that day, whether it's go buy groceries afterwards, and just make sure you're not, really stressed out for your job. Because if you're stressed out at work, it's going to lead to a bad attitude. So we can't have that in a hospital. Especially being the CEO of the company, we always have to make sure that we're thinking a step ahead, and we have to make sure we're caring for our patients. The other one is social awareness. So this one's a big one, especially for nurses and doctors in the hospital. Just being socially aware of who's around you and what to say in front of patients, in front of family members that are patients, whether this person's going through a difficult time, and say they have stage 4 cancer and it doesn't look like they're going to make it anytime soon. Just being able to know what to say to these people, giving them reassurance of doubt, just letting them know their options, what they can do or what we can do to help provide a better quality of life for patients, and then looking at it through the COVID-19 lens. This disease just catches up on people so quick, and it happens so suddenly. One minute you can have a negative test one day, and then 24 hours later you lose your smell, you lose your taste, and you don't really know where to go from there. Just getting tested, making sure, contacting who you exposed to the disease are all major components to this. Just being socially aware, especially in the work setting, is really something that doctors, nurses, even myself, being the CEO, have to manage. The last thing is relationship management. So relationships with nurses, relationship with doctors, relationship with patients, with the family members of those patients. Just being like a shoulder to be on, or just making sure that they know what's going on with the patient, especially now in the hospital settings. They're not allowing family members to go into the hospitals and say, if my grandmother went in and she was just getting her checkup or whatever, and I'm not allowed to go in, I can drop her off. I can't sit in the waiting room. I can't be in her room, even if she just got out of surgery or something like that. So just making sure like there's communication between both the patient, the patient's family, and the nurses, whoever's taking care of that patient, and the doctors, whoever's treating that patient too. All these are steps that we have to take in order to make sure that we follow all the guidelines and stuff. And just these are the 4 things that really strike out most, especially with the COVID-19 crisis going on, that we have to really make sure that we get into, and that we have to nail down these things. Being self-aware, one, just knowing how we're feeling that day, making sure that we're good to go to work. Number 2, the self-management, making sure we're on time to work, making sure we're taking all the protocols, all the necessary steps and guidelines in order to perform at work. social awareness, making sure we know what to say around either nurses, patients, or the family members of those patients, and then the relationship management, making sure we communicate with the patients and communicate with the families of those patients. And that was my 5 minutes. I hope you enjoyed it, and thank you for watching.